What are the planes of the body in anatomy? Have you ever wondered how doctors and scientists describe the human body? One of the key ways they do this is through the concept of planes of the body. These are imaginary flat surfaces that help divide the body into sections. This makes it easier to talk about where things are located and how they move. Let's break down the main planes you need to know. First up is the sagittal plane. This is a vertical plane that splits the body into right and left parts. When it runs right down the middle, it is called the midsagittal or median plane. If it runs parallel to this but not exactly in the middle, it is known as a parasagittal plane. This plane is especially handy when looking at structures that are symmetrical, like your arms and legs. Next, we have the coronal plane, which is also known as the frontal plane. This vertical plane divides the body into anterior, which is the front, and posterior, which is the back. It runs perpendicular to the sagittal plane. This plane is great for viewing the front and back of organs and body systems, making it easier to understand their layout. Then there is the transverse plane, sometimes called the axial or horizontal plane. This one is horizontal and divides the body into superior, meaning upper, and inferior, meaning lower parts. It is perpendicular to both the sagittal and coronal planes. The transverse plane is often used in medical imaging techniques like computed tomography scans and magnetic resonance imaging to show cross-sections of the body. Additionally, there is the oblique plane. This plane cuts the body at an angle that is not a right angle to the other planes. It provides diagonal sections when needed, which can be useful in certain examinations. Understanding these planes is essential in anatomy. They provide a standard way to describe where organs and body systems are located and how they move. For instance, when looking at the muscular system, the sagittal plane helps explain movements that go forward and backward. The coronal plane, on the other hand, relates to movements that go side to side. In medical imaging, these planes guide how scans are performed and interpreted. This allows for a clear view of internal structures, making it easier for healthcare professionals to diagnose and treat conditions. So, the next time you hear about the planes of the body, remember the sagittal, coronal, and transverse planes. They form the basic framework for understanding how our bodies are organized and how they function.